Clinical psychologist Dr. Kelli Rugless joins us now. She's the chief clinical officer at Project HEAL, which is an eating disorder nonprofit. Dr. Rugless, good to have you with us. So one of the things that really stuck out from Savannah's report for me was that until 2020, a person had to miss 3 periods to even be diagnosed with anorexia. Clearly, that focus is on girls. Why is it that men and boys are so often left out of the picture when it comes to body image issues and the research?
Well, again, I think it has a lot to do with exactly what you said, which is the diagnostic criteria in general for a very long time really only kept women in mind and really focused on this idea of thinness as being a main driver for eating disorders. But what we know now is that it really has more to do with beauty standards and those being unrealistic, whatever those might be. So male beauty standards aren't always surrounded by thinness. Oftentimes they're more about bulk and muscularity, and so that changes the picture. But they couldn't receive the diagnosis or treatment because of the narrow criteria.
So as you're pointing out here, I mean, there is no one version of what an eating disorder looks like. In some situations, you simply can't tell by looking at a person. So with that in mind, what are some of the signs we need to look for that might indicate that someone is struggling?
Absolutely. So some of the warning signs, particularly in boys, that you want to look for are a preoccupation with muscularity or muscle tone. Again, we're used to thinking about thinness, but with boys, that's not always the beauty standard. Being larger might be the beauty standard. You're also going to want to look for signs that their eating patterns have changed. So a boy who used to love home-cooked meals is now skipping dinner and saying, oh, I'm full, no thanks, or even bringing their own food to dinner because now the food that mom makes is no longer in alignment with his meal plan or his body goals. Another warning sign might be a change in his social life, right? So he might skip out on birthdays and other events that he would usually never miss because he knows that food is going to be served there that he can't eat. And so rather than be awkward and not eat, he'll choose not to go at all. So the social circle gets smaller. Another major one is a change in exercise. And that can usually mean an intensity increase of exercise or a length of exercise increasing. And that might happen gradually over a few weeks, or it could happen right after a large meal because now there's this thought that you have to burn off that meal that you just ate. And then lastly, a really important one is temperament changes. So angry outbursts, irritability. I know we normally think of, adolescent time period as being one of those areas where kids' emotions are run high, but noticing more irritability and rigidity around meal times can also be another important sign of an eating disorder.
Great signs to look for. Dr. Kelli Rugless, thanks so much for joining the discussion with us.